Each November, we recognize Diabetes Awareness Month. The American Diabetes Association says more than 500,000 adults in Louisiana have been diagnosed with diabetes, significant numbers. And Dr. Sarah Schwertner from Primary Care Plus joins us now to talk about how to lower your risk. Dr. Schwertner, good morning to you. So let's kind of start at the beginning, if we could. This is basically how the body turns food into energy, and the mechanics get messed up when you have diabetes?
Yeah, so diabetes, one of the biggest things about it is your body has difficulty processing the food you eat. So almost everything that we eat gets turned in some form to sugar, and we call that glucose. And that glucose is in the bloodstream, and it signals the pancreas to release insulin. So when that insulin is released, it's like a key for your cells. So the cell's little kind of gateway opens up and allows the blood sugar to come in, which turns into energy. And so with diabetes, you have a problem either releasing the insulin, which is type 1, where you don't make the insulin, or you have too much insulin floating around, which causes the cells to be resistant to it. Yeah.
So what are the symptoms? How do you know that, oh, wait a minute?
So there's a few symptoms that are very common. Sudden weight loss, increased thirst, if you're urinating all the time, severe fatigue. Sometimes people get nauseous and vomit. That's usually type 1. If you do have concerns about any of these symptoms, you might want to talk to your doctor so they can at least check your blood sugar.
And I know you're more susceptible to this as you get older, over the age of 45 or so. How does family history play into this?
So we learned through research that type 2 diabetes is actually more common to inherit from your parents or your grandparents. Now, type 1, we believe, could be caused by autoimmune disorder, where your body actually attacks the pancreas. But it also is interesting that if you have type 1 in your family, it is more common as well. But type 2 is more common, more genetically inclined.
And as with so many other, predicaments and ailments and advice, leading a sedentary lifestyle is also a risk factor. You got another example of you've got to get up and move.
Yeah, so leading a sedentary life, if you have an office job, and you're sitting in a chair all the time, recommendations are try to take breaks where you're getting up, moving around. Being overweight, of course, is one of the risk factors. There are certain other people that are more highly to get diabetes, different ethnicities. So,
we talk all the time, or doctors do on our program, about the importance of that annual checkup. What exactly is pre-diabetes, and how important is it that you've got it, and how much help can that be for you?
So pre-diabetes is when your blood sugar is elevated, but it's not to the diagnostic level of having diabetes, and it's one of those things that's a warning sign. So I tell my patients, you have pre-diabetes, there are things you can do right now to prevent turning into full-blown diabetes. And so exercising, changing your diet, including more whole grains, healthy fats like salmon, avocado, things like that can prevent turning into diabetes and having to be on medication.
And let's not go all negative here from that point of view. You have some success stories, some people that you have seen who are going down the wrong path, and they can turn it around?
Absolutely. I've had a number of patients that just made some healthy lifestyle choices, decreased their carbohydrate intake, started exercising, losing weight, and they went into the normal range where they were not pre-diabetic. So there is hope.
We need to remember that sometimes too. I think Dr. Sarah Schwertner, we appreciate your time this morning. Thanks.
Thanks for having me.